Hello, I'm Marissa.
And I'm Sarah, and today we are here to talk about broken heart syndrome.
Now, I don't know about you, Sarah, but I've had my heart broken a few times, but that's not what we're here talking about today, is it?
No, broken heart syndrome, also known as Takotsubo cardiomyopathy, apical ballooning syndrome, or stress cardiomyopathy, is a cardiovascular condition where the left apical portion of the heart enlarges.
And it can be caused by no trigger at all, or an emotional stressor like a divorce, death in the family, or in some weird cases, your favorite soccer team losing a game.
Recently, it has been found to be caused by happy emotional stressors like a wedding anniversary, a job promotion, a birth of a child, a physical or combination of physical or emotional stressors.
Since broken heart syndrome is preceded by an emotional event, this leads science into thinking that it is caused by a surge of stress hormones like epinephrine or adrenaline, even though we don't know the exact cause to date.
If this hypothesis is true, it would explain why broken heart syndrome can be experienced after use of drugs like Cymbalta or an EpiPen, whose active ingredients increase the level of hormones in the brain, or is epinephrine, and why the symptoms often reverse themselves within a week.
The symptoms being chest pain and shortness of breath.
That sounds an awful lot like a heart attack.
Yes, broken heart syndrome does present like a heart attack. We interrupt this video for an important message. If you are experiencing chest pain and or shortness of breath, call 911, as this could be a heart attack and not broken heart syndrome. There is no need to risk your life. Seek medical attention right away. We now return to your video. But there is a difference, and that is on a physiological level. In a heart attack, there is a complete blockage of coronary arteries due to a blood clot, whereas in broken heart syndrome, the coronary arteries are narrowed, resulting in reduced blood flow to the heart.
This is especially important if you are female or are elderly, as these are the at-risk populations for broken heart syndrome. Risk also increases with age, and the reduced blood flow caused by broken heart syndrome can lead to arrhythmias, irregular heartbeats, hypertension, low blood pressure, pulmonary edema, a buildup of fluid in the lungs, repeat episodes of broken heart syndrome, or even death.
In fact, the risk of death increases 5% per year after a person has experienced broken heart syndrome. With all that said, how is broken heart syndrome diagnosed?
There are many different tests used to diagnose it. A doctor will ask for your personal history to see if you have any pre-existing cardiovascular issues that could be causing your symptoms, and to see if you have recently experienced an emotional event that could lead to broken heart syndrome.
A doctor may also have a chest x-ray or an echocardiogram. This uses an ultrasound wave emitting probe and a detector that measures the amount of time the sound waves take to return to tell the density of an object. This data can be put together by a computer and create an image of a cross-section of the object. These are done to assess the shape of the heart. The doctor is looking for enlargement of the heart and ballooning in the apical portion of the left ventricle.
Other tests that may be conducted include electrocardiography, ECG, which is a simple test that is non-invasive and detects and records the heart's electrical activity via strategically placed electrodes on the skin surface. The test shows how fast the heart is beating and whether or not it is steady or irregular. In addition, it records the strength and timing of electrical signals as they pass through each chamber of the heart. With respect to the ECG of a patient with broken heart syndrome, their trace may show abnormalities such as ST segment elevation, T wave inversion, and pathological Q waves. Another test, called a troponin assay, which is a blood test, These tests are conducted in addition to ECGs, as this enables physicians to assess the presence of cardiac damage. In the case of broken heart syndrome, decreased myocardial perfusion results in necrosis of cardiac tissue and the release of troponin into the bloodstream. Patients with this disorder therefore have elevated levels of this biomarker for heart damage in their bloodstream.
The last test that could be done is a coronary angiogram, which is where dye is injected into the coronary arteries of the heart and an X-ray machine is used to visualize the flow of the dye. This is used to see if the coronary arteries are completely blocked, as they are in a heart attack, or only partially blocked, like in broken heart syndrome.
The good news about all of this is broken heart syndrome is treatable. Yay! Initial intervention is usually aimed at improving blood flow to the heart, relieving fluid buildup, managing blood pressure problems, preventing blood clots, and lowering stress hormones.
To achieve this, physicians may prescribe the following medicine: ACE inhibitors to lower blood pressure and reduce the workload on the heart, beta blockers to slow heart rate and lower blood pressure, diuretics to help reduce edema, fluid buildup in tissues associated with the heart, anti-anxiety medications to help manage stress hormones. And for more information on these drugs and their mechanisms, we challenge you, the next generation of scientists, to go out and investigate them from yourselves and learn as much as you possibly can.
Finally, the last thing you need to know about broken heart syndrome is prevention. The only prevention is reducing the stress in your life. So go to that yoga class, have a bubble bath, read a good book, or whatever relaxes you, and remember to always keep learning.